Hey golfers, is low back pain keeping you away from the course this season and kind of preventing you from playing a full round pain-free? Well, if so, don't worry. It's one of the most common conditions that kind of affect golfers all around the world. Around 65 to 70% of golfers can start to experience this low back pain at some point through their career. So we're going to talk about one of the most common reasons as to why that can be occurring. So when we're kind of talking about our backswing and our golf swing, we kind of look at how we're going to be positioned through our midsection here. So we need to remain kind of stable throughout our golf swing throughout the entirety of it. One of the most common problems with that is something that we call early extension. So when I set up in my golf swing and I come all the way back and start to come through on my downswing, if I start to stand up really early and kind of extend through my low back early on this downswing, it's going to be a lot of pressure in through our low back joints and in through our muscles in a forceful and repetitive motion. So we swing the golf club quite a few times during a round of golf. And if we start to at any time take this back and our hips start to come forward too early through impact, we can start to forcefully load into this extension position in our low back. Now, the early extension kind of movement is a problem for many reasons. So again, we talked about how that force kind of goes through the joints and in the muscles in our low back, but it can also cause a lot of funky things going on with your golf shot and your swing itself. So this can cause issues with consistent ball striking. It can take away from your power of your golf shots, and it can also start to cause you to block shots off to one side or actually even start to hook. So a big problem that a lot of people deal with is that early extension. We're going to start to talk about some strategies on how to deal with that. So first thing that I always typically look at is the golfer able to kind of control how our pelvis moves in this kind of hinged golf position ready space. So I've just got a club that I'm kind of resting on, and I'm going to pretend like my pelvis is kind of a glass of water. So I want to try and dump the water out the front of the pelvis and then dip the water out of the back. So we're going to be rocking back and forth through this pelvic rotation. And now we should be able to do this nice and smoothly if we're stable through our low back. But if we're not, and we go into this dipping the water out of the front, and then we try to come out of that and we notice it's really shaky and kind of stuttery, that might be an indicator that our extensor muscles are kind of cranked on from doing this early extension move, or we're lacking a little bit of stability in our low back. And so one of the exercises that we can try to kind of work on our stability and kind of controlling that extension through our low back is actually getting down onto our hands and knees. And then we're going to find kind of a neutral pelvic position and then find that middle. We're going to hold this nice and stable, and on the hands and knees, we're actually just going to be bringing up one leg, keeping the knee bent, kind of in like a modified bird dog position. Keeping that knee bent, we're just going to bring that into extension, kind of squeezing through the glute and coming back. Big goal with this one is going to be trying to avoid this big dumping into extension through our low back. So big breath, big pressure in through our midsection, big squeeze through our glute, and then we're going to keep that knee bent, extend as much as we can, and then control that back down. So again, kind of performing that on both sides, working a little bit on that stability and controlling through extension in our low back. Hopefully that helps prevent a little bit of that low back pain on the course. Thanks.